Thanks, Kate. Oh, here's our agenda for today. We have Shantz from the Covenant Health Palliative Institute, and we'll be speaking about the Compassionate Alberta movement there. Then we'll share a few resources and some FYIs. And then just to let you know, the next meeting is October 28th at 10 o'clock. And the Alzheimer's Society of Alberta and Northwest Territories will be presenting. They have 4 new projects that are underway, and so they're going to come and tell us a bit about that. So I will hand it over to Marianne now.
Thank you, Helen, and I will share my screen. All right, and thank you all for being here. It's a pleasure to get to connect with you, with your group, and today I'm going to be talking about Compassionate Alberta, building community support for palliative care and advanced care planning. And this is we're coming to the tail end of what's been almost a 5-year initiative at the Palliative Institute with a focus on education and resources for public audiences. So we also have work to support healthcare professionals in the area of palliative care, developing their skills. But we've had, for the past number of years, also had a focus on public education, public resources. And Compassionate Alberta is the umbrella term that we've developed for this area of work. And so I'm happy to speak to you today about that, recognizing that many of you are here from all over Alberta, different kinds of community organizations and grassroots groups, and our goal has really been to work alongside communities in Alberta, groups in Alberta, to educate, to empower, and to build support at the local level for people to be better prepared and better supported through serious illness, aging, death, and grief. I also want to acknowledge that I'm speaking to you today from Treaty 6 territory, from Amiskwaciwâskahikan from Edmonton. And I'm grateful, having moved here as an adult, to have had the opportunity to learn from different Indigenous knowledge keepers, elders, and teachers. And I want to continue to embrace those opportunities to learn more about this land and how to walk in right relation with the First Peoples and thinking about the generations to come, the relationships and the way that we leave this land for our children and our children's children. I'll give you a little bit of context about the Palliative Institute, because not everybody knows about us or knows much about Covenant Health, depending on where you are in Alberta. So Covenant Health works in partnership with, or has traditionally worked in partnership with Alberta Health Services as part of Alberta's integrated health system. And operates 7 hospitals and 10 continuing care sites in Alberta. The Palliative Institute specifically is a research, education, and public advocacy hub for palliative care that was established in 2012. And in 2020, we received some funding from the government of Alberta for 2 public awareness initiatives. And that's what this presentation is coming out of and going to focus on. So there's a lot of work that we did in the early days to figure out what does it mean to improve public understanding of palliative care, public awareness of palliative care, what are our goals, what are the outcomes we're hoping to achieve, and I could say more about that, but I'm going to kind of skip through some of that and let you know that really what we ended up focusing on was these 4 areas. So within this Compassionate Alberta initiative, our goals have been to build community support for people who are seriously ill, dying, caregiving, grieving, to help people learn about palliative care, what it is, and the benefits it offers, to support people in planning ahead for their health and personal care, and having conversations about their values and their wishes, and to build some comfort in talking about death and dying. And so I'm going to kind of go through the resources we've developed or adapted in each of these areas. And I recognize that some of you probably have familiarity with palliative care, with advanced care planning. I want to share with you some of the language that we're using. A big focus has been to use plain language that people can understand, that makes sense, that resonates with people. And so kind of sharing with you how we talk about these topics with the public, how we introduce these resources. And I encourage you to think about what areas of focus might kind of resonate or fit with your community and the people that you serve. I also find that we all wear two hats. We have our professional hat and we have our personal hat. And so it's often when I present to groups, I may be presenting to someone who's, the volunteer coordinator at X organization, but they're also thinking about their aging parent, right? And so that's okay. I think I just like to acknowledge that I wear multiple hats. You all wear multiple hats, and we bring our whole selves to this work. And so wherever you see a connection or a relevance, I welcome that. I welcome you to think about that and to reflect on that. So in each of those 4 areas, what we did was we did a scan for existing resources around the world that had been already developed, because a lot of organizations around the world are sharing some of these goals of improving public understanding, improving engagement, and encouraging people to do planning ahead and some of these things. So we did a scan for existing resources. And then our goal was not to kind of start from scratch or reinvent the wheel, but to then work to adapt those, make them relevant to Alberta and promote them here. And so we kind of went through this process then of bringing together working groups that would advise us on how to adapt the resources we'd identified and to make them, strengthen them, make them relevant. So we were really fortunate to have about 40 people that participated in 5 different working groups advising us on how to adapt our resources and giving us feedback on those. Each working group met 4 or 5 times starting in the spring of 2022 and gave us really valuable input. And then all of these resources that we developed were launched over the course of the kind of summer, fall of 2023. And so a big part of this from right up until the present has been collaboration and connection with various groups and organizations across the province. And one of our big goals has been to move outside of the health system so that support and education and resources are happening in the community and not people aren't waiting until they're entering the health system with, a really severe diagnosis, for example. But that there is support that's embedded in their communities, and that this education is happening upstream, that even maybe before someone gets to the point of really needing palliative care, for example, they have a better awareness of what it is, what it offers, how to access it for themselves or someone close to them. And so we've sort of we've seen kind of 5 key groups emerge as really kind of partners in this work, and that includes local hospice and palliative care societies, public libraries, senior serving organizations, legal professionals, and faith and cultural communities, as well as a range of other nonprofit community organizations, particularly groups like Caregivers Alberta and then the disease-specific organizations like Alzheimer's Society, Wellspring, and some of those kinds of groups. And so we've really kind of leaned into these partnerships where there seems to be a natural alignment in terms of some of the work and the needs and the priorities that we're identifying. So I'm going to start by talking about this area of building community support. And I want to introduce something that's known as the Compassionate Communities movement that kind of underpins a lot of this work. And so I'm going to play a short video here for us to watch together before we dive into this a little bit further.
Murray Hall Community Trust is a charity that works with the communities, and how we do things is about working alongside people and trying to find solutions in the community and empowering people. So facilitating their empowerment, making sure they have information to make the correct informed choices. So when you talk about compassionate communities, it's about the community looking after its own in really vulnerable stages of their lives, end of life, and for those living with bereavement after. More and more people rely on medical services at end of life. So if you think about how many people would like to be at home at the end of life, which is the majority, but currently the situation is that the majority still die in institutions like hospitals. So how do we change that? Some of the answers there is that we need to be better supported at home. It's a mixture of family, friends, professional services. It's what you have around you, those support systems, but one of the crucial ones is your family. When people are diagnosed with cancer or life-limiting illness, and when they get to maybe the palliative care stage, the rest of the community don't know what to say. So they don't say anything and they stay away. So one of the things, it's breaking down that barrier of having the conversations around that myth and fear around death, dying and loss. So that when in your circle you have got someone who is ill, you're not frightened of just the subject. Even if that's saying, I don't know what to say, but I'm here. The British are very good at saying, how are you? Is, oh, I'm fine, thank you. We want to put on an exterior that everything's okay. People find it really hard to ask for help because we live in a society that wants you to be independent. So trying to be dependent on someone else or interdependent on someone else, people find quite difficult. So it's helping people to say it's okay to ask for help. When you are dying, there's still all the practical things that need to happen in your life, like putting out the rubbish, changing the bed, and a bottle of milk. So there's practical things that people can do, but they may not realise that those little things make a real difference to people remaining at home. It's helping people to understand that their small act of kindness or compassion can make a difference to that person. We have lots of people come along and they need to rebuild their social network because they used to be a couple and now they're on their own, so they have to find new ways of being on their own. And they really struggle walking into new groups. So we went along and spoke to the walking group and said, how would you feel about being part of a compassionate community? So they were really in favour, because when you are bereaved and just walking and talking can be quite therapeutic. So we provided training for them to understand what bereavement feels like. So that if they did have people on their group and they started to cry, it's no big deal, it's just part of grief. So instead of the bereavement group, there's these groups that you can go to in the community. So you're not stigmatising them, you're not labelling them, you're normalising bereavement and grief, but helping them to feel accepted into a walking group where they can build up their own social networks. There has been a number of groups who we've supported to increase their capacity to become compassionate communities. That's included a walking group, a gardening group. We've worked with schools, so they've become more attentive to people in their pupils living with loss. Mostly it's hospices that provide palliative care, but the hospices aren't everywhere, but community groups are. Community groups have been doing befriending, supporting people in lots of different ways. So there's a lot we can do on capitalising some of the support that's already happening. So it's about helping them to extend their reach and their boundaries to people at the end of life. And it's about normalising, because death is not a medical incident, it's just part of life. And I think the less fearful we are, the better chance that we have of achieving the kind of death that we all want.
There's a few things that are maybe a little bit British in there that that are a little culturally different, but I'm interested in hearing from you. Feel free to write in the chat or share things that stood out to you from that video. I'm not sure if this is something that you've heard of before. Just a little bit of background. The Compassionate Communities movement is about 20 years old, and it's a global initiative. It's been put into practice in small and large communities on local and regional levels around the world. So that's obviously taking place in the UK, Australia, Spain, India are kind of have major initiatives in this space to build community support. And she focused quite a bit on end of life and death, but it can also encompass a broader range of people who are aging, increasingly frail, caregiving. So it can be a bit broader than that. But hopefully that gives you a bit of a sense of what that means, and maybe prompts some thoughts about how that aligns with work that you're already doing in your communities. So yeah, again, I welcome you to share some thoughts. And yeah, some good practical ideas in there. I see Crystal talking about the walking groups, gardening groups, schools, the normalizing of death. So yeah, quite a few ideas to hopefully kind of to think about and chew on there. Another way to think about compassionate communities is to think about building circles of care. At its core, the Compassionate Communities movement is focused on building communities that recognize that care for one another during sickness, dying, and grief is not something that's just for health and social services, but is everyone's job, and that we can all play a part in. And so, I think about this in terms of building circles of care. You've got the person needing support and their primary caregivers at the center, surrounded by different layers of support. So you've got an inner network of people that are closest. Sometimes we talk about these are the people that you would see in your pajamas. These are the people you'd still want to see even if you're really sick. Then you've got an outer network of people that you're still personally connected to. And then a wider community, people you might not know, but they live in your neighborhood. They're part of your faith community. Their kids go to the same school. Some of those kinds of layers of connection. You're in the same running club, some of those kinds of things. And then the professional support layer. There's certainly continues to be a role for professional support. But I think what this movement is doing is trying to encourage greater community support at all levels so that families, so that primary caregivers don't feel isolated, don't carry the burden alone, and that maybe we look first to our own networks and maybe secondarily to some of the professional support. And then important policies, leaves from work, funding for medications and equipment at home, and all these kinds of things, compassionate care benefits that are really important. We went the wrong way there. We commissioned a poll through Ipsos last year, and we've just repeated it again this year, exploring some of these topics in Alberta, levels of awareness and understanding. And we found that nearly 2/3 of Albertans agree that caring for people with serious illness is everyone's responsibility, but only 35% said they were aware of supports available in their community, and only 43% said they knew how to support someone with a serious illness. So part of this work is about, building knowledge and building capacity and confidence to play a role in supporting the people around us. So in this area, I mentioned that we've kind of done a scan. We looked for resources that could support people in each of these 4 areas that we're focusing on. And in this area of building community support, the tool that we adapted for use in Alberta is called Palliative. It's a series of short interactive public education courses that we developed or adapted in partnership with Palliative Care South Australia. So the series was originally developed in Australia. And then with the advice of our working group, we've adapted 4 of these courses for Alberta. So they're about 90 minutes long, they're interactive, and they build some knowledge, they share resources, and they are facilitated by Alberta health professionals with palliative care experience who have gone through our training program. And those 4 courses are Your Role in a Compassionate Community, What is Palliative Care, How to Have Conversations About Dying and Grief, and What Matters Most. And then we've also invited and partnered with community organizations to host these courses for the public. So far, since we launched this 2 years ago, 40 facilitators from 18 locations across Alberta have completed the training, and you can see where they're located on this map. We would really love to train people in the north, but north I know is often stretched for resources and so has been a challenge to reach. But we're really pleased by the interest from facilitators across Alberta. And then those facilitators in turn have delivered 69 PalliLearn courses attended by over 1,100 Albertans so far. And we ask people who attend courses to complete a survey. 99% of the survey respondents say they would recommend this course to others. So this is something we have offered as a Train the Trainer program. Our goal is not, as the Palliative Institute, to go out and deliver these, but to equip local facilitators who are delivering these courses in their own communities, usually in partnership with an organization in their community, a public library, a hospice society, others that are interested. And I love the qualitative data that comes out of the surveys. So when people say in their own words, what are they taking away from the course that they attended? And so these are some of the things that people have shared. That one on the bottom right, we can all be part of a compassionate community. We don't need to think big. Small neighborly acts of kindness and compassion will go a long way. So little snippets from people when they're voicing what they're taking away. And just to give you a sense of some of these, the groups that are offering these, definitely seeing interest from libraries. Edmonton Public Library is offering in-person and virtual courses. Lots of partnerships with hospice and palliative care societies, seniors organizations as well. Unison in Calgary is going to start offering these virtually in November, and other community organizations. So if this is something of interest to you, there's a couple ways to go with this. You can reach out to us and find out if there's someone who's already trained in your community as a facilitator. If you know a health professional who would be interested in training that has some palliative care experience, we're going to be running another training probably in February. So that's another opportunity as well. So I'm going to move on to our next area of focus, which is helping people learn about palliative care. So what is palliative care? Palliative care is care to relieve the symptoms and stress of living with a serious illness. And the reason that we think it's important to raise public awareness of palliative care is that this type of care is often poorly understood and not always offered to or accessed by the people who would benefit from it. And so we want to kind of provide better understanding of the support palliative care can offer so that it's something that someone might seek out for themselves or someone close to them or be receptive to receiving. We hear from clinicians sometimes that people don't want palliative care, I think often because of misperceptions. So the resource that we've developed in this space was inspired by an online module created by the All Ireland Institute of Hospice and Palliative Care. And then we've kind of run with this idea and created our own online module. It's for a public audience, so a big focus on plain language, and it's also multimedia. We interviewed 3 Albertans who had personally benefited from palliative care, either as a patient or a family member of someone. And those videos are integrated throughout where you hear their voices and their stories. And there's an umbrella theme that runs through it that you can see on that screenshot from the cover slide. And the idea here is inspired by a piece called Palliative Care is the Umbrella, Not the Rain. So the idea of palliative care as kind of providing support, shelter in the midst of a serious illness. Key messages throughout this module that we're hoping people will take away from it are that palliative care can benefit people starting at the time of diagnosis with a serious illness, that it can benefit people of any age with any serious illness, that it's an extra layer of support that can be received along with other treatments. It's not like an either or of a treatment to lengthen life or to stop the spread of a disease, that you can have both at the same time, and that it's care for the whole person. And that's really kind of the heart of the module, is this section where we look at that palliative care includes support in terms of someone's physical well-being, their emotional well-being, their social well-being, and their spiritual well-being. And so when you get to this section, you can click on those plus symbols, find out more about the support that palliative care can offer in each area, and then you can listen to an interviewee talking about the support they received in this domain. And so I'm just going to play this video that features Bill, a young man from Calgary whose mother received palliative care several years ago when she had been diagnosed with a severe liver disease. Bill's an amazing guy. He's just about finished his nursing degree at U of C right now. And I think he's going to change the world. So it's really amazing to talk to him about this experience.
With palliative home care, we were able to get, social work services, which provided financial income resources, which provided family meeting to facilitate, because, being in a family that might not agree on the same values, it was really helpful to have those facilitation of, family meeting to see like what page are we on and what do we want for my mother, who was the recipient of palliative care. With palliative care, we really had a comfortable space to ask those questions to our healthcare and social service professionals. It was also explaining what it looks like in terms of the disease progress. And I think that really, really helped for us to prepare emotionally for what's to come. I primarily benefited the most in our family because I actively sought out for it. My palliative home care nurse, I've spent probably like hours upon hours each week on the phone conversing with her to look at what else can we do for my mom. And she was always there. She was very on top of everything in terms of the other referrals and looking for information, forwarding my way. It was very great in terms of that support.
And then the other thing we did when we interviewed these three Albertans for this module is we asked them at the end, excuse me, what's something they would like everyone to know about palliative care. And then we took their answers and compiled them in this video that I'll play for you as well.
Palliative care still includes intervention. We're not stopping all medical efforts. It's not giving up on someone. It's doing what's best for her.
I think that's the big misconception about palliative care. As soon as they hear that phrase, they think that the end is near and it's a negative thing. And I thought, in fact, I see it as a positive because it's there to improve my quality of life. It makes your life so much easier during an incredibly stressful time.
Families can self-refer to palliative home care. I wished we could have had this implemented earlier. At least we would have been connected to palliative care nurses who could have helped us navigate, to help make decisions, to help prepare for the next phases.
Palliative care looks at a person holistically and creates that plan that's very catered to that individual, because it really asks critical questions for the patient and their family members. What is your top value that you want to maintain? And palliative care really, really gave that decision to us as family members and patients.
Implementing palliative care early on any life-limiting illness journey would provide so much support, resources, and in the end, improve the quality of life and reduce pain, suffering, and anxiety for both the patient and the family.
So I'm going to move into the third area of focus for this work, which is planning ahead. And just as a basic introduction to the concept of advanced care planning includes thinking about, talking about, and documenting the health and personal care you want to receive now and in the future. So this includes things like care you'd want or not want, where you'd like to be cared for, as well as what's most important to you as a person, what makes your life meaningful, what brings you joy, and some of those kinds of things. Advanced care planning is good for everyone, every adult to do. In many ways, it's best done when you're healthy before there's an urgent need for it. But particularly as people are aging, being diagnosed with chronic or serious illnesses, it can become more important. There's 5 steps to advanced care planning. Those include thinking about your values and your goals, who's most important to you, what's most important to you, learning about your health. What is, if or the person you're supporting, what is their diagnosis? What are treatment options? What is prognosis? What does this look like as a disease or a condition progresses? What are the benefits and drawbacks of different approaches to dealing with this illness? Usually this is something you or the person you're supporting want to explore in conversation with your healthcare providers. Choosing someone to make health and personal care decisions for you if you're unable to make them for yourself. In Alberta, this person is called your agent. And then sharing your wishes with the people you trust and with your healthcare team. So having conversations with family, with the people that support you, as well as the people that are caring for you as a healthcare team. And then finally, recording wishes. So recording these in a personal directive, that's the name for the legal document in Alberta, that outlines your health and personal care instructions, as well as who will make decisions for you, officially naming someone as your agent. So why is this important? It's important because it allows people's care preferences to be known by the people who matter most to them and their healthcare team. And it can help prepare people to make decisions about their care. Sometimes when we hear about advanced care planning, we think about, our minds go to incapacity and the importance of having someone who can make decisions if you're not able to make them yourselves, which can be important, but that's also just a piece of advanced care planning. It can also be about preparing yourself for your own decision making. If someone has a serious illness, there's lots of decisions that happen over the course of that illness, about treatment, about where they live or where the care happens, all kinds of different things. Do I delay this treatment so I can go on that trip I really wanted to take? It's all kinds of things that happen. And so doing advanced care planning and thinking through your values and your priorities can help you make some of those decisions by establishing a framework of priorities and values, that then those decisions happen within the context of that existing sense about what's most important and what are my priorities. So the resources that we've developed to help in this space include a toolkit called the Plan Ahead Toolkit, which is to facilitate education in communities around health, financial, and estate planning. There's a slide deck that's freely available online. You can adapt it. You can use parts of it. You can add your own stuff to it. It's kind of free and editable. There's a survey and there's a starter kit that we've just created recently. So this is sort of like resources that people who attend these sessions can take home to get started or take next steps or know, where do I go next? Where do I go from here? And the other resource that we've developed in this space is the My Wishes Alberta workbook. This is a fillable workbook that was adapted from a resource created by Canadian Virtual Hospice called Coming Full Circle. Canadian Virtual Hospice created this in partnership with a circle of knowledge keepers and elders from across Canada. And so we have collaborated with them to adapt this for Alberta, to build in Alberta specific information, because advanced care planning really is provincial. The healthcare processes and the legal context vary from province to province. And so this is sort of focused on Alberta. It's not designed to replace formal advanced care planning documents like an advance directive, but it's really designed to prepare people to have conversations and make decisions about their care. So it's fillable. There's some open-ended sections where people go through and do some reflection. And then there's sort of more kind of scales like yes, no, maybe sections where people can kind of check a box. One of the things that we've built into this adapted resource is on the right there under that image. It says, what would you want your care providers to know about you as a person so that they could give you the best possible care? And some of you may recognize that as the patient dignity question. This is something that palliative care physician Harvey Chochinov in Manitoba has done a lot of work around and has done a lot of research to show that when healthcare providers better understand their patients as people, they provide better care. And so what we're trying to do here is to empower patients and caregivers to start telling their care providers who they are as a person, what's important to them as a person, so that their care providers know who they are, they know how to provide the best possible care for that person. So that's something I really love about this workbook is just prompting people to start thinking about that. And if you've ever supported a parent or someone else going through the healthcare system, being that advocate for who they are as a person and what's important to them is often a really important role that we play as supporters of people in our lives. And then the final area, as we get towards the end of our time here, is the area of talking about death and dying. So that video early on that I showed talked about the fact that death is a natural part of life. We see it in the natural world around us. We have all experienced it in our lives. And, there is evidence that avoiding the topic can cause people to hide their feelings, to withdraw, that not talking about it can, or that talking about it can reduce stigma and fear and help people feel supported rather than alone. So we haven't really adapted this, but the resource or tool that we've promoted in this space is Death Cafe. This is one that may be familiar to some of you. A Death Cafe is just a group-directed conversation about death and dying. All that you need to run a Death Cafe is a facilitator. They don't have to have any qualifications. They don't need to be a healthcare provider. They don't need to be someone that works in a professional capacity in this space. They need to be someone who can create a safe and open space for people to have conversation. You need a venue. Sometimes these are virtual, sometimes they're in person, and a group of people who want to get together and talk. The kind of main parameter is that there's no agenda, objective, or themes. So you can't be providing education. You can't be selling things. You can't be promoting a particular view or perspective. You're simply opening up space and people talk about whatever they want related to death and dying. Often these start with just the question, introduce yourself and tell the people at your table why you came, why you wanted to come and talk about this. And then it kind of goes from there. And so a couple things that are important to know is it's not a venue for grief support or counseling. They're not necessarily the best places for people who are actively grieving. And they are not supposed to be marketing or promoting products. So we've created some resources to help with the facilitation of these. We created a short promotional video with a group in Wetaskiwin, a facilitator and a couple of participants from a Death Cafe that happens monthly in Wetaskiwin. We created a report on Death Cafes based on a survey and focus groups that we ran with Death Cafe facilitators from across Alberta. We have a webinar recording that features a roundtable with experienced facilitators. And there's a Facebook group for facilitators to connect and support each other. So that brings me to the end of this sort of whirlwind overview of the resources that we've developed. In terms of I guess what we're sort of inviting you to think about, PalliLearn is sort of unique in terms of having this facilitator training program. The other resources are kind of freely available on our website for you to pick up and run with and use as needed, as you see kind of a fit in your community. I invite you to kind of the Understanding Palliative Care module, the My Wishes Alberta workbook are really designed for individuals to use and to go through. If you'd like to use these in your own life and build your own knowledge, you can go through them. You can share them with volunteers, patients, families. That could be in the form of links, or we have print materials. Oh, I forgot to mention, My Wishes Alberta, we have now translated into it's available in 5 languages. So English, French, Arabic, Punjabi, and Spanish. The starter kit for the Plan Ahead sessions is also almost done being translated into those languages. So those are available, and we can provide copies of those print materials. We know seniors in particular often like print materials and things they can hold in their hands. And then you might consider having education or workshops in your community. And we are happy to provide support to talk to you about what might work for you, for your community, and how we can help with that. We're seeing our resources being integrated. And so, this is, I guess, again, example of partnership. So the Office of the Public Guardian and Trustee, linking to our My Wishes workbook from their website, the Cooperative Memorial Society, Cancer Care Alberta. And so this is something that, we've worked closely with these partners throughout, and My Health Alberta's palliative care page. So seeing these resources being shared across the province. So thank you so much for your attention, for sticking with me. We maybe have a little bit of time. I invite you to maybe consider some of these questions, or just speak up if you have other kinds of comments or questions.
Marianne, there was a question quite early on in the chat there, just around a little bit more information about the policy area and kind of what does that look like? What are some of the issues? What came to my mind was friendly employers in terms of support needed, but maybe there's other areas too.
Right.
Yeah,
thank you. That's a great question. So I'm thinking about like that circles of care where there was the policy layer. Yeah, that's a great one. I was at a conference in the spring, and workplaces was one where in Europe, there's a big project right now to work with workplaces, and it's very grassroots. Like, I think it's this kind of connecting people in communities model of get a group together in the kind of 10 partnering workplaces, and that group figures out what could we do in our workplace that would help support people. So whether that's people, needing leave to be a caregiver, whether that's, grief support, whether that's awareness or education or training, like there's lots of different ways to do that. Policies. So I think, workplace policies at the provincial level. I think there are some efforts that have happened to, for example, improve support at home for people, right? It used to be that if you were in hospital, your medications were covered, but when you were at home, your medications were not covered. And so there's been efforts to build in policies so that, you can get those medications paid for if you are at home. So some of those kinds of things, support with things like, cleaning and there is, some support now with those kinds of things, that if someone's at home as opposed to in hospital, there's support to relieve the burden on caregivers from having to do some of those kind of mundane tasks that take so much energy and attention. So there's all kinds of areas. Schools is one. Hospice Calgary and Pilgrims, I know, have done a lot of work in the space of like grief support for children, but I think, there's still room to build that in as well. So those are the things, I guess, that come to mind for me right now.
Thanks. I know, Maureen, you had asked that question. Anything else you wanted to add? And then we'll go to Crystal after that.
I don't think so. That was really good. I'm with social prescribing, so I travel all over Central Alberta into rural areas, and I would really like to get my hands on some of these workbooks to take with me.
Yes,
because a lot of the seniors are at their end of life with very serious illness. I can think of 2 ladies in stage 4 cancer in one little hamlet, and this would be really great for them to kind of help them focus. So if I can have the information on how to get these booklets to them, I would love it, because a lot of people hand us their booklets, for example, safety in a rural area for fire, et cetera, et cetera. Well, they know I go all over the place. I'm having these stacks of resources, but they're so valuable. And this is exciting. Palliative care was my favorite area when I was a home care aide. So this is just getting me all excited. Feelings. So if I could get copies or know how to
Sure.
order them now.
Yes. Yes.
you.
I put my email in the chat, so any of you feel free to reach out to me for help with some of this. I'll also make sure, I think that Helen and and Kate will send out probably a copy of the slide deck, and I can make sure some links are in there too. We are working
Or
if
follow-up email. That's right.
yeah,
Mhm.
if we're in the midst right now as our funding is coming to an end, AHS has something called Data Online, which is a service where you can order materials. And we're working to kind of prepay so that there's a supply of these that people can order for free online, and so that's another sort of long-term way that people will be able to access these. So that's great. And yeah, the other thing is in terms of policy, if you're working with someone in particular, I would encourage you to like connect with the palliative care team in your area, because that's one thing that they're great at, is helping people identify like what are the programs and helping apply for those. That is a support that they offer. Like this, if there's a social worker on the team in particular, or a nurse as well, they can help families with that.
Thank you. And Crystal, over to you.
Thank you. That was a very good presentation. I learned a lot that I didn't otherwise know. I am interested, you mentioned that there was some bereavement training for like walking groups, gardening groups, or schools to assist with peers. Where would someone go about starting something like that?
Mm-hmm. Yeah, so I guess, I think that came up in the video. So we haven't, as an institute, haven't worked in that space. There is in our PalliLearn series, there is the one course is called How to Have Conversations About Dying and Grief. So that's like a 90-minute course. On our website, we do link to some organizations that are offering these. So for example, Unison's going to start offering them online. They're free. So you could look at that. Another great, I don't know if Sonia Jacobek has presented to this group on her Good Grief nature walks. So she's a nursing professor at Mount Royal who has partnered with parks. She started with Fish Creek Park in Calgary, but there's a few provincial parks in Alberta now. And I think a couple of hospice societies that have started to implement her program. And the program is sort of 8 weeks of walks where it's a group that gets together, and people can be coming who are grieving, or people who just want to be there for people who are grieving. And you do 4 walks and you repeat them twice. And there's a little bit of very gentle kind of education and support. It's an awesome program. So I think it's called Good Grief Nature Walks. I'll see if I can get a link for that as well.
Great.
But,
you can send that out to Marianne.
Yeah. And so I think the principle too is like, you're right. Like it's good to have a little bit of education, a little bit, something that can build comfort for people, but that also it doesn't have to be complicated, right? That it can just mostly be about showing up and listening and not being afraid. And so I think that's sort of some of the principles behind it. So that's a great one that comes to mind for me.
So that leads me also to the Death Cafe idea. As the 55 plus coordinator here for FCSS, part of my scope is to promote intergenerational programming. And I'm wondering, because loss is something that happens at any point in your life, right? So, kids can experience that too. I'm wondering if you think that maybe involving the older generation along with the younger generation, if they could kind of take that journey together, do you think that would be beneficial?
Yeah, that's an interesting one. So we haven't really targeted or worked a lot with like the under 18 kind of space. Death cafes have proved to be pretty popular on like university and college campuses. So I think if you're looking at like the young adult population, like that would be probably an easier place to start. In terms of, maybe trying to bridge that. That's a neat idea. Because you're right. I think something like, 75% of people will have lost like at least a grandparent by the time they finish high school, right? So as well as other kinds of losses. So That's an interesting idea. I think it could be a little kind of trickier. You might want a bit more structure for kind of an under 18 kind of group.
Okay. Last question, and then I'll let someone else talk. Do you have maybe like a contact for a successful death cafe? I could like pick their brain.
Right. Yeah.
I don't want to reinvent the wheel.
Yeah, sure. Yes. So I think that's part of the Facebook group. We've kind of handed that off a little bit as this grant stuff's winding down. And so I'm not 100% sure how active that group is. Another thing is if you wanted to email me, we have some contacts. Like we could reach out to a couple people and just see if they'd mind us putting in touch with you. So I'm sure that would be something we could facilitate. Yeah.
Okay, perfect. Thank you, Marianne.
A couple of things in the chat box here. One was just that Nicole put a link into Good Grief, Walking with Grief and Loss in there so people can get more information there. And then we have a question from Doug from Caregivers Alberta to saying he really enjoyed your presentation. And Doug, come off if you want to say more about that, but that he works with caregivers in coaching capacity, but was wondering why facilitators don't kind of require training for the death cafes.
Mm. Yeah, so death cafes is like they started in the UK in I think around 2010-ish. And it was just a guy whose mom was actually a psychotherapist. He and his mom started them. And I think it's partly about normalizing, right? So I think there is, I wouldn't say just anyone can facilitate, but what you need to be an effective facilitator is to be able to create that safe space. So it's not like you need to have some sort of health profession background or that kind of thing, or counseling background, because they aren't supposed to be counseling groups. It's creating space for people to connect and talk. So that's kind of the rationale behind it. So there's things that come up with any kind of group dynamics, right? One person might be dominating the conversation or trying to take it in a certain direction. Sometimes an active facilitator might want to say, let's, redirect, right? Some of those kind of facilitation skills, but it's not as if you need to have some sort of specific professional background, because it's not supposed to be education. So, I mean, the temptation there then is for someone to be trying to educate everybody else about, here's what I know that you should also know. And that's not the goal, right? So it's, I think that those are kind of the reasons behind it. It was just a simple concept.
I think there's a lot of information coming out about the great value of peer support. So it's kind of along those lines too with it. Yeah. Well, thanks everybody for the great discussion and questions. Marianne, thanks so much for your presentation and responses there. We've just got a couple of resources to share with everyone as we wrap up our meeting. I'll just bring up my screen again. There we are. So there's an upcoming webinar that actually myself and our consultant Ann Miller are going to be doing for Healthcare Excellence Canada on measuring value through an social return on investment. And that's on Thursday, September 25th. So you can register for that if you're interested. Also, again, promoting the Healthy Aging Alberta Summit that's in October. I know it'll be a great networking event. Lots of good speakers there on many different areas. And then just wanting to let people know about a funding opportunity through Healthcare Excellence Canada. It's called Care Forward, and they've got 3 different ways that you can kind of connect with them around looking at different funding opportunities for things that you may be working on. And then just our usual connection to our website, and then also that we're connected on Core Alberta, of course, and the recordings of this will be on there. Kate will send a follow-up email with all these different resources that we talked about today. So just wanting to say thank you to everyone for having joined today, and we will see you in October.